Hi, welcome to Wins Pharma. Today's topic is Introduction to Dosage Form, Classification and Definitions. The word posology is derived from Greek. Posos means how much and logos means science or to study. Posology is a branch of medical science which deals with dose or quantity of drugs which can be administered to a patient to get desired pharmacological actions. That means posology means which deals with dose, quantity of drugs, and how much should a patient should be administered and show their pharmacological actions. Here that some factors influence the dose. Those are like age, condition of patient, severity of disease, tolerance, both natural and acquired, idiosyncrasy, route of administration, formulation used, drug interactions, and rate of elimination. Now let's see one on one. Age. Pharmacokinetics of many drugs changes with age. Pharmacokinetics means what drug does to the body. What it does to the body is called pharmacokinetics. So while determining the drug dose, the age of an individual is plays and great significance. Children and old people need lesser amount of drug than the normal adult dose. Here, children can tolerate relatively larger amounts of belladonna, digitalis and ethanol, while elderly patients are more sensitive to some drugs like hypnotics and tranquilizers, which causes confusion in them. Next, sex. Women does not always respond to the same action of drugs in the same manner in men. Morphine and barbiturates may produce more excitement before sedation in women. Special care should be taken when drugs are administered during menstruation, pregnancy and lactation. In women, while prescribing a drug, we should always consider many factors like menstruation, pregnancy and lactation. Those are, in menstruation you should avoid allos such as long purgatives, and in pregnancy some cross the placental barrier. Those are anti-malarial drugs, drastic purgatives, ergoid alkaloids, and some of them can cross placenta and affect fetus are alcohol, barbiturates, narcotics and non-narcotic analgesics. During lactation, that means if mother is feeding, then you should avoid antihistamines, morphine and tetracycline. Then coming to body weight, the average dose is mentioned either in terms of mg per kg body weight or total single dose for an adult weighing between 50 to 100 kg, and this does not imply to obese children or malnutritionist patients. It should be calculated according to their body weight, according to their patient body weight. Next, coming to route of administration. While IV doses are smaller than oral, because IV shows direct effect, these are directly enter into bloodstream, so onset of action is quick but also increases the risk of drug toxicity. Effectiveness of drug formulation is controlled by route of administration. Then that means how much the drug will show its effect depends on route of administration. Then time of administration. That means food presence may delays the absorption of drugs, and the amount of drug which is very effective before meals may not be that much effective after meals. For example, some examples like irritating drugs like iron, arsenic, cod liver oil should be given after meals. Next, environmental factors. Daylight is stimulant. It enhances the effect of stimulating drugs and diminishing the effect of hypnotics. Darkness is sedative. Hypnotics are effective at night. amount of barbiturate to produce sleep in the morning is higher than night. Alcohol is better tolerated in cold environment. Emotional factors. The personality and behavior of physician may influence the effect of drug, especially in psychiatric disorders. These patients may depend on personality and behavior of physician to 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 show its pharmacological action of a drug. Then presence of disease. If a patient is already suffering from a disease and we are giving other treatment, for example barbiturate and chlorpromazine, unusually prolonged effect which we can see in liver cirrhosis patient. If liver cirrhosis patient is taking barbiturates or chlorpromazine, that will show unusual prolonged effect. And streptomycin is excreted through kidney. If a patient is having kidney disease, it is not working properly, so it may cause lead toxicity. Then accumulation. Drugs which are slowly excreted may build sufficient high concentration and produce toxic symptoms if repeatedly administered for long time. That means if a drug is excreted slowly from the body, so some amount of drug is present in the body and which is causing toxic symptoms and showing its higher concentration. If we take repeatedly for long time, it might happen. For example, digitalis emitting heavy metals. This process is used in drugs like phenobarbiturate in treatment of epilepsy. Next, additive effect. What is additive effect? Total pharmacological action of two or more drugs which is equals to sum of their individual pharmacological action. For example, combination of ephedrine and aminophylline, which is given in treatment of bronchial asthma. Here total pharmacological action of two or more drugs. If a patient is taking two drugs and pharmacological action is having two, then which is equals to sum of their pharmacological action, which means combination of these two drugs pharmacological action is also 2. So this is additive effect. Next, synergism. Two or more drugs given in combination to increase the pharmacological action. For example, procaine and adrenaline, that means increase the duration of action of procaine. If these two drugs are given at a time, then what happens? These adrenaline will help to increase the duration of action in adrenaline will help procaine to increase its duration of action. That is called synergism. Two or more drug given in combination to increase the action. Then antagonism. The action of one drug is opposed by other drug on same pharmacological action. That means if a drug is showing antipyretic action and the other drug is also showing opposite direction. If one drug is showing antipyretic action, that is increase of temperature, then the other drug will show decrease of temperature. That is called an antagonism. Antagonistic responses are valuable in treating poisoning. For example, milk of magnesia given in acid poisoning. This is helpful to neutralize the effect of acid in acid poisoning patient. Then coming to idiosyncrasy. What is idiosyncrasy? That is drug allergy. Nowadays we call it as drug allergy. Extraordinary response which is different from its characteristic pharmacological action. Not showing its pharmacological action, but it is showing extraordinary other response is called idiosyncrasy. Small quantities of aspirin may cause gastric hemorrhage. Then quinine may cause ringing in ears. Some are sensitive to penicillin. Then tolerance. When an unusual large dose of drug is required to elicit an effect ordinarily produced by the normal therapeutic dose. If a person is if a person is given 40 mg of some drug, this is normal dose. Then the same is given to 40 mg who is having tolerance to the drug will not show any effect on the body, such as smokers can tolerate nicotine. If nicotine is given 40 mg, if nicotine is given to non-smoker, this 40 mg nicotine acts its action, but when it comes to smoker, this 40 mg does not show any effect. Alcoholic can tolerate alcohol. There are two types of tolerance. One is true tolerance and one is pseudo tolerance. True tolerance is produced by oral or parenteral route of administration. Pseudo tolerance means if a drug is consumed only while oral. Next, tachyphylaxis, that is acute tolerance. What is tachyphylaxis? When a drug is administered in short intervals, cell receptors gets blocked. This shows pharmacological action decrease. Then when a drug is administered in short intervals, then the cell in the body gets blocked. Then what happens? Its pharmacological action will be decreased. The decreased pharmacological action cannot be reversed by increase of dose. If we increase or decrease, might not change the effect of pharmacological action of the drug on this cell. That is called tachyphylaxis. Okay. Metabolic disturbances. What are metabolic disturbances? Changes in water, electrolyte balance and acid base balance, body temperature, other physiological factors may modify the effects of drug. For example, salicylates, they do not have antipyretic effect, but they reduce body temperature only if a patient is having high temperature. Okay. Then absorption of iron increases from GIT if a patient has iron deficiency. Then these are the factors which influence dosage forms. Now we shall see the calculations of children and infant doses. How we will calculate children and infant doses and adult. For example, an adult is given normal dose, then how do you calculate for a children? Then the doses are calculated in proportionate to age, body weight and surface area. Doses proportionate to age. Here we have two formulas. Coming with age, we have Young's formula. Young's formula is used under 12 years, which means dose of child is equals to age in numbers by age in numbers plus 12 into adult dose. Then coming to others formula, that is Dilling's formula. Dilling's formula is used between 4 to 20 years of age, which is easy and quick. Dose of child is equals to age in numbers by 20 into adult dose. Then dose proportionate to body weight, that is Clark's formula. Dose of a child is equals to child's weight in kg by 70 into adult's dose. Then dose proportionate to surface area, which is complicated, and the percentage of adult dose is equals to surface area of child by surface area of adult into 100. And this is about introduction to dosage forms and calculations and factors that are affecting dosage forms. If you want these notes, then comment me to know, then I'll give you notes. Thank you. See you in next video.